Okay, it's been recorded, yes.
Yeah, we can start.
Okay. Okay, thank you. Thank you so much. So, hello everyone. Good morning, good evening, and a very warm welcome to European Young Family Doctors Movement session of the 4th International Eastern Black Sea Family Medicine Congress. My name is Şeyma Handan Akyan. I am a family medicine specialist, and I have the pleasure of moderating this session today. This is a hybrid session. Some of our speakers know that some of our participants are here with us in Ordu, and others are joining online from across Europe. To our online speakers and attendees, welcome. We are delighted you can be part of this session. Before we begin, I would like to express our gratitude to the distinguished professors organizing this Congress, in particular our honorary Congress President, Professor Dr. İlhami Ünlüoğlu and Professor Dr. Özgür Enginyurt, and the head of Department of Family Medicine and University Congress, Ordu University, together with the entire cassette and Ordu University organizing them, for bringing this international meeting to life and for giving young family doctors such a visible place in this program. I would also like to thank Dr. Reda Nur Ağırbaş, the EYFDM Turkey Exchange Coordinator, for her dedicated work in putting this session together, and of course all of our speakers, distinguished speakers who have prepared presentations for our today. A few words about EYFDM, European Young Family Doctors, before we start, for those who are new to it. The European Young Family Doctors Movement, the EYFDM, is the Wonka Europe network for family medicine trainees and family doctors in their first 5 years after qualification. Its mission is to connect young family doctors across Europe to be their voice, to improve education, research, and exchange opportunities in our discipline. And we will see some great examples today together. And today's sessions will give you a tour of what the movement does, from professional identity and advocacy to international exchange told by people who live it. We have 6 presentations today, each 15 minutes, so I will keep up us strictly on time. Questions will be taken within each speaker slot as time allows, and any remaining questions at the end. And I would like to ask you to please mute your mic microphone and your video, not video camera, just on the microphone when the speaker is speaking. And this meeting is being recorded for your consent. So our first speaker is Dr. Charlotte Morris, my dear friend joining us from the United Kingdom. And Dr. Charlotte Morris is a GP, an academic based in Manchester University, UK, focusing on epidemiology and health equity for disadvantaged populations, especially elderly patients. As an award-winning NIHR doctoral fellow, and her current work explores health inequalities in dementia. Alongside her clinical practice, she is recognized leader in international primary care, holding the 2024 EYFDM Early Career Researcher Award, and currently serving as the EYFDM liaison to the Wonka Europe Executive Board. On a personal note, I had the privilege of being hosted by Charlotte Morris during my own UK primary care exchange 2 weeks ago, so I can say firsthand what a generous mentor she is. And Dr. Morris will speak us about professional identity strengthening. Charlotte, the floor is yours, and you can share your screen and start.
Okay, I will. Thanks, Şeyma, for that lovely introduction. It was so nice to have you visit our practice. Great. I'll share my screen now. Hopefully this will work. Can you see the slides?
Yes, Charlotte, yeah. I can see your slides.
Great. Okay, so I'll make a start then. So thanks so much for inviting me to do a talk today. It's a real privilege to tell you a little bit about professional identity strengthening in family medicine. And as Şeyma said, I'm Charlotte Morris. I'm a family medicine doctor in Manchester. and also a researcher and involved in EYFDM as the liaison to the executive board of Wonka Europe. So I'm going to tell you a little bit about the UK context, particularly focusing on a research career. And we can maybe think about how that relates to being a family medicine doctor in Turkey or across Europe as well. So the overview of what we'll talk about briefly, we'll talk about family medicine as a specialty in the UK, and think about how that kind of compares to your context. We'll look at the training pathway, so how you become a family medicine trainee and then a family medicine specialist doctor. We'll talk about professional opportunities and identity strengthening for family medicine doctors, again, looking in the UK context and comparing. And I'll do a little focus on being an academic GP, so doing research as well as clinical practice. We'll look at a day in the life of a family medicine doctor and how my day compares to your day, and maybe talk about how Shema found that when she visited my practice. And then we'll briefly talk about the exchange scheme and how it works in England and Wales. And I think then Paola and the other speakers will talk more about EYFDM exchanges. So first of all, family medicine in the UK. So in the UK, we have around 40,000 family medicine specialists. That includes qualified family medicine doctors and also trainees learning to be family medicine specialists. We generally use the term GP or general practitioner rather than family medicine doctor. And if you were to talk to a patient or a non-doctor in the UK, they wouldn't recognise a family medicine doctor really. They would recognise the term GP. So that's what we generally use to describe our profession. We work in practices, so that's a kind of clinic or surgery which serves our local population. And from where the clinic is situated, we usually look after patients from around 2 to 5 miles of a radius around where the practice is, because we still often do home visits and we can't have people too far away because of time reasons. Patients register with the practice, not a personal doctor, although they can choose to always see the same doctor for continuity if they want to. I imagine that that's similar in other European contexts as well. And practices range in size. Some are quite small with just a few thousand patients. Others are huge with tens of thousands of patients. And a small practice, often they're quite rural. So maybe up in the Scottish Islands, they have very small practices. And in mid Wales, where there's a sparse population, often they have smaller numbers of patients. It's more the big inner city practices that have a lot of patients. And our training is controlled by the Royal College of GPs, the RCGP, and their logo's in the corner here. And you've probably heard of this organisation. They are the kind of UK branch of Wonka Europe, and they are very helpful in terms of the exchanges as well as training for family medicine doctors. So here's the route to becoming a family medicine doctor in the UK. And I'll talk to you about where you can kind of drop in at different times. So you start your medical school training, which takes 5 to 6 years. This is your undergraduate degree, probably very similar across Europe. Once you have completed your medical school training and you are a doctor, in the UK, you have to do 2 years of general training in hospitals, and that we call our foundation training. Now, at this point here, between medical school and starting the foundation training, international medical graduates can drop into the UK scheme. So you can do once you've done your medical degree, you can then do your general training in the UK, even if you didn't train here. After the general training, that's when you can apply to become a specialist. And for us, for family medicine, it's a recognised specialty, and you can start your family medicine training after your 2-year general training programme. Family medicine training takes 3 years for most people in the UK. First 2 years is a mix of hospital and community training. You do a written exam in the second year. In the third year, that's when you undertake or you complete your year in primary care, so your year in family medicine. In that year, you do a final exam where you're examined watching patients and treating patients. So a person comes in to watch you with different patients. and assesses you. And if you pass that exam, you exit the training programme as a qualified family medicine doctor or GP. So you can drop in if you wanted to work in the UK from a different country after medical school, after general training to apply to become a family medicine doctor, or after you complete your family medicine training. And you would have to do different exams within the UK to practice here. But those are the kind of areas or points in the process where people can join from internationally. So what are the professional opportunities when you're a GP in the UK? Well, you can be a salaried GP, a partner, or a locum. A salaried GP is employed by the practice. A partner GP owns and runs the practice, so they own it and run it as a small business, and they take on the financial risk associated with that. Or you can be a locum doctor, which is like a fill-in doctor. So that means if somebody is off sick, if they are on maternity leave, you work for a short time in a practice, but you're not necessarily employed by them. Locum doctors often earn a lot more money, but they don't have the continuity with patients. So it's a balance of weighing that up. There's also academic or research opportunities, which I do and which we'll talk about shortly. You can do teaching, so training younger early career family medicine doctors, running teaching programs within your community, and that's also available within universities. So a lot of family medicine doctors in the UK are also teachers. And you can also do special interest training. So as family medicine doctors, we are all generalists, but we can all, in the UK, we can all choose to do a special interest if we want to. My special interest is in women's health. So I also, as well as being a general family medicine doctor, run gynecology clinics in the community, menopause clinics, and I fit coils, implants, different kind of contraception devices. So that's my special interest. Other family medicine doctors will have interests in dermatology or in psychiatry, in child health. Really, you can do a special interest in anything in the UK. And finally, you can do fellowships. So these are a year out of clinical practice where you go to either do a research job or a management job or within different contexts or government roles within the NHS, our health service. So lots of opportunities. So a little bit now about being a researcher or academic in the UK. So we spend a proportion of our time doing research based at a university, and this is integrated into our clinical training. So as part of my training when I was a family medicine trainee, I also did research training. To progress as an academic GP, you need to complete a PhD. That's the stage I've just completed now. And after your PhD, you start your postdoctoral roles and jobs. The School for Primary Care Research runs research throughout the UK, and it's a team of 9 universities across the UK who collaborate. There's opportunities for us to collaborate internationally through publications, conference presentations, things like today. And from Shayna's exchange visit, we're already planning to work together on some papers, which is a great opportunity for both of us, I think. The training path to become an academic is similar to what I told you about, but it's just a little bit different at this stage here, which you can hopefully see on the screen. You take extra time doing your training, and you apply for different jobs that have academic time built into them, so you can become a high-level researcher as well as a clinician. And that's what I do day to day. So 3 days a week I work here at the University of Manchester, lovely old building, and I do my research, which Shayma explained, is about inequalities in care for elderly patients in the UK, particularly people with dementia. So it's nice to have those two opportunities professionally within kind of being a UK family medicine doctor. And then we'll just briefly talk about a day in the life of being a family medicine doctor in the UK. So usually we start around 8 a.m. Not sure if that's the same for you in Turkey or if you start a little earlier or later. See around 20 patients in the morning, a mix of telephone and face-to-face appointments, around 10 to 15 minutes each. And then a lot of paperwork after the morning surgery, signing prescriptions, reviewing letters, writing the notes. And one difference that we discussed is signing prescriptions. So if it's a regular medication, I don't need to see the patient or speak to them. I can literally just issue the prescription without any kind of issue or problem. At lunchtime, we go to do visits to the patients at home who are housebound, can't come to us. And then the same again in the afternoon, 15 to 20 patients, a mix of appointments, and then admin at the end of the day, and usually finish between 6:30 and 7 p.m. So it's a long and busy day, but very rewarding and very kind of different things to do throughout the day. And last thing I'll tell you about now is the EYFDM exchange scheme. And I'll just talk to you about what's happened in our practice, because we've had quite a few visitors to my practice. Everyone is very welcome to visit anytime. We love having people to visit and find that it's great shared learning for us in my practice, and hopefully for the people who visit. When Shema came to visit, we had meetings with our palliative care team. We saw a wide range of different roles. So even though she was only with us for one day, hopefully it was a very good learning experience. We also have the Hippocrates exchanges for 2 weeks. So you can get a really in-depth view of family medicine in the UK through that as well. And Shema, I don't know if we have time to hear the video from Karina. It's about 1 or 2 minutes.
Yes, we have 3 minutes right now. Yes, we can hear.
Cool, great. So you're probably sick of hearing from me. So we'll hear now from Karina. She visited for 2 weeks last year for an exchange. She's from Austria, and some of you may know her. So we'll just hear about what she had to say before we finish.
Dear Charlotte, we can't hear the voice.
Oh no! Oh.
Maybe you can tell us or
yeah. So yeah, if you can't hear it, I'm not sure what to do. So maybe I'll just tell you briefly about Karina.
Yes, please. I would like to hear her.
So yeah, Karina was a medical student from Austria. She came for 2 weeks to the practice. Karina's also an opera singer, so she really got very involved, especially with the older patients. And she went to our care home for the older patients and sang for them, which was a really beautiful experience for the patients, for Karina, for us. So I think it just shows how wonderful it is to share our skills and our knowledge across Europe and learn from the exchanges. So hopefully that's been interesting to hear a little bit about the UK context. Interested to hear how it compares to Turkey, and hopefully this means thank you in Turkish. I'm not sure if it does.
Yeah. Teşekkür ederim. Thank you so much, Charlotte. And I would like to hear Karen's message, but I'm sure that you and she went back home with great experiences and great memories. And
I hope so.
Yeah, perfect. And thank you so much. That was such an insightful and informative presentation on professional identity strengthening in UK. We are run out of time, probably. Yes, I'll also check that. Is there any question? A brief question. By the way, during the presentation, if you have questions, you can write in the chat. After that, I will read them if we have time. No, we don't have. So I would like to ask you, but before that, during my exchange, I was really impressed by how you manage everything, both as a great GP who truly knows your patients and builds strong relationship with them, and as an amazing researcher whose work has promising implications for the future health, UK health, especially for elderly. I was really impressed. I'd like to ask one quickly. It's great that you have protected research time as a GP researcher, but it must still be really exhausting at times. What are your life hacks for balancing it all?
Oh, thanks, Shoma, for your very kind words. It was a joy having you visit as well. I think it's always a difficult balance, whatever other things you do outside of your clinical work. And I've kind of got used to it now. I've always been an academic and a clinician. So I split my time very strictly. If I'm doing my research day, I do research. If I'm doing my clinical day, I do clinical work. And I try not to kind of merge them. So that works for me. And I also try to separate my free time from work as well. So as you know, I like being out in nature, going hiking, exercising. Yeah. And for me, that really helps to kind of balance the research, the clinical work, and the kind of free time, and keep those three things structured. So that's for me. But everybody has different opportunities and ideas, I think.
Perfect. Yes, you're a great example for each of us. And thank you so
Bir de
much,
sunum
Charlotte.
yaptım diyorum gidince ya. Garip şekilde. Bana pek garip gibi gelmemişti.
Zübeyir Bey,
Aklına
sizi
Vakası
duyuyoruz
bu.
ama
kalsın.
mikrofonu
Ona
kapatabilir
baktım,
misiniz
ona
acaba?
baktım. Gönderdim. Hakikaten garip bir şey.
Okay, Zübeyir Bey. I think it was okay. Great. And let's. Zubeida has a question, but we will keep it if we have time at the end of this session. Dear Paula, our next speaker is Paula Sala Ivares from Spain. Paula is a recently qualified family medicine specialist who is passionate about planetary health, medical education, and women's health, dedicated to empowering the next generation of healthcare professionals. She takes an integrated approach, combining these areas to develop solutions that are globally sustainable and locally accessible. She is also the president-elect of the EYFDM, European Young Family Doctors Movement. Today, she will talk about policy transfer and advocacy, how young family doctors can carry what they learn into real influence on health policy. Paula, over to you. If you're ready, you can share your screen and start.
Herkese merhabalar. Hope it's understandable. So I'm going to start by sharing the presentation. Okay. Hope you can see it.
Yes.
Okay, perfect.
Yes.
So thank you so much for having me today. It's a great pleasure to be with you all. I'm Paula, I'm the president-elect of EYFDM, and the title of this presentation is not just a catchy phrase, it's actually a challenge. Because EYFDM gives you the tools to travel, we have already seen with a Charlotte presentation, to learn, to connect, but what we do with all of that. And today I want to propose an answer. So I don't have any conflict of interest to declare, apart of being the president-elect of EYFDM, and wishing you all to join the movement. So EYFDM, for those who don't know, is the European Young Family Doctors Movement. We are the largest professional network for young GPs on this continent, but we are much more than a logo. We are a part of a global family. There are 7 young doctors movement around the world, from Polaris in North America to Afriwan in Africa. This means that when you join EYFDM, you're not just joining an European network, you're joining a global community of people who believe that young doctors have a voice that matters. So how can you join? There are 6 main pathways: the annual congress, the special interest groups, webinars, the bridge project, bursaries, exchanges. These are all tools. So think of them as your training ground where you can learn, build relationships, start to understand how health systems work beyond your own practice walls. But joining is just the beginning. The real question is, which brings us to the second part of this presentation, is what we do, what change can we do together? So starting with the next event, we are having the EYFDM pre-conference in Paris in June 29-30, right before Wonka Europe Congress. And next EYFDM forum is going to be in Malaga, in Spain. So hopefully I will see you all there. They both are family-friendly and easy English events. And you can submit your abstracts for Malaga, and there are going to be also bursaries available. So I encourage you all to attend. Here you can see some photos from the past pre-conference in Lisbon. Hundreds of young family doctors from across the globe learned, debate, and build the alliances that make advocacy possible. Because advocacy is not just like a solo sport, it requires exactly this kind of networks, getting to know other people from around the world. We also have the special interest groups. These are where the deep work happens. These are theme groups, sorry, for mental health, for planetary health, for rural medicine, for AI and digital health, where you turn peer exchange into collective knowledge. They organize webinar where you can join and learn from other peers. And there's also the Bridge project and bursaries. The Bridge project connects EYFDM with non-European young doctors, and it's literally about building bridges across health system and cultures. And we also have bursaries and networks, which make participation possible for everyone, not just for those with institutional support, because equity in access to these tools is itself like a form of advocacy. Here you can see me in my first Wonka conference some years ago, and it was the way I came to know EYFDM, so I encourage you all to apply for a bursary. And we also have exchanges, which have also been mentioned before. Exchanges are part of perhaps the most powerful tool for EYFDM. So we have the 2 weeks in another European country with Hippocrates, or 4 weeks globally with FM 360. So why does this matter for advocacy? Because you cannot advocate for a better primary care system if you have only seen your own. So seeing how Portugal, Spain, Japan organizes family medicine gives you the comparative evidence to say that things can be done differently and sometimes even better. So what about the change? And this is where we arrive to the second half of our title. Exchange is wonderful, but it's not enough. So we need to translate what we learn into real change. And in the framework for health advocacy, we work at 3 levels: for individual patients in our consultations, for our communities, but also at policy level. The good news is that EYFDM already has a clear advocacy agenda. We have already made a change in these 4 areas: in accessibility, with bursaries, in family-friendly events, also in climate change and planetary health, and in the recognition of family medicine as a specialty in the EU level. So, for example, the 2023 Wonka Europe revision formally links family medicine advocacy to planetary health, recognizing that the climate and the environmental change are health issues demanding physician action. So GPs, we as family doctors or trainees, are in a unique position as role models for sustainable living and as advocates for policymakers on environment health links to community, national, and European levels. And the list of challenges goes on. We also have rural medicine and medical deserts, training programs, quality, mental health, the gender gap, working conditions, and the role of digitalization and AI on primary care. So every one of these is an issue where young family doctors have a stake and a legitimate voice. But we don't do this alone. EYFDM sits at the center of a network of European family medicine organizations. We have EURACT for education, we have AGPRN for research, EQUIP for quality and safety, EURIPA for rural medicine, and EUROPREV for prevention. Each of these is a potential ally for advocacy. The more you're connected to EYFDM, the more doors open, not just for your career, but for the issues you care about. And to make a change, we require evidence. So EYFDM supports young doctors to produce that evidence through the Wonka Europe Scholarship, the international web-based course on research in primary healthcare, the Young Doctors Movement Global Mentorship Project, and the Aspire Physician Leadership course. Because leadership and advocacy are inseparable. You cannot influence a system you don't understand, and you cannot change it without the skills to communicate, to build coalitions, and to be heard. So, Wonka's Europe 23 definition says family medicine has a strategic advocacy role in the community, both community, regional, national levels. And this isn't just an idealism, it's a professional competency that should be taught during our training program. And at a global level, EYFDM coordinates with WONCA, with WHO, with the European Doctors Network, with World Medical Association Junior Doctors Network, and IFMSA. So this is perhaps my favorite slide because I think the bigger barrier to advocacy among young doctors is the feeling that we are not ready yet. That advocacy is something that for senior doctors or for people with titles. So this slide is the answer to that. We are not waiting to the future to arrive. We are the present. Our experiences, our residents and as early career GPs are exactly the evidence that the system needs to hear right now. So follow us on Instagram, visit our web, or subscribe to our newsletter. These are the easiest first steps. From here, you choose the level you want to engage, from a webinar to a working group to a policy paper, and hopefully also in Malaga next year. And I'll leave you with this. Exchange is how EYFDM starts. Change is what it is for. So I hope today you leave with both the tools and the motivation to be part of the change. Thank you to Shukur Ederim, and I'm happy to take any questions. Thank you so much.
Thank you, Paolo. You're so kind. And it is really reassuring to know the future of leadership of our movement is in such capable hands. And we are so proud of you. Thank you so much. And it was really meaningful to see familiar faces in your presentation. And I really appreciate you including us. I'm excited also about Malaga. Hopefully, I am also planning. I know Ruveda and my friends are planning, and hopefully, more Turkish family doctors also will come after this presentation. Such a great presentation, and we have approximately 5 minutes for questions and answers, which is great. And I'm just checking the checkbox if there's any question or. So far, there is not. I would like to ask you about where do you start if you want to do advocacy, but your health system gives you very little room to act.
So I think as young family doctors, we are actually doing advocacy every day in our practice, telling patients what can improve their health. And we also can go beyond that, working with the community, and of course, joining these organizations as EYFDM that let you get to know other people from other parts of the globe, to learn from other perspective and to make change happen in your area, but also globally. So I think there are different steps, but we are actually doing it every day.
Great. Thank you. Such an encouraging answer. Perfect. And if there is no question, I would like to, I have one more. Yes, there is no. I think, and as I know, was also in our system, many young doctors are experiencing burning out. And how do you ask someone who is exhausted to also do advocacy?
I think that's exactly what I was talking about, that we are not asking people to do anything more. we are asking people to do actually what already is happening to them. So, for example, sharing the burnout among young GPs, it's itself one way of advocacy. So, sharing it, doing papers, doing research, sharing with colleagues, presenting that evidence in events like EYFDM Forum or WONKA conference, it's also a way of advocacy. It's
Yes,
raising the topic so others can be aware of that and maybe change will happen after that.
yeah, for sure. So you mean that EYFDM is doing about advocacy for us? Could you expand more what is EYFDM doing about advocacy, especially for advocacy?
Yeah, so one of the examples that I just mentioned is, for example, being a family-friendly event. It allows people with kids to join the events. It's a term of equity and accessibility, also the bursaries. So these are like very small examples about how changing things can make the event or the movement more available and more inclusive for everyone. But we have also released like a planetary health policy when we aim for improving our events and our day-to-day activities to be more planetary health conscious, so we can do actually what we want. I mean, this is up to us. This is the main point, that we as young family doctors don't have to wait years to be the persons doing the decisions, but we can be ourselves the ones who do that. So
Yeah,
it's up
great.
to us.
Thank you. Yes, yes. Thank you so much to Paula. It was really amazing presentation. And
Thank you.
I can't see any question or any contribution in the chat, so we can continue with Reda. And I'm happy to introduce our next speaker, Dr. Reda Nur Auerbaş. She is newly specialized family physician based in Kahramanmaraş, city of Turkey, with a clinical and academic focus on preventative healthcare, adolescent medicine, and substance use disorder. She has researched addiction behaviors among high school students and holds certification in smoking cessation. Dr. Arbash is actively engaged in international primary care networks. She currently serves as the EYFDM Turkey Exchange Coordinator, having previously participated in the exchange program in Estonia. And additionally, she is a participant in the Ascent 2026 Leadership Development Program by the Johns Hopkins Bloomberg's School of Public Health. So she's also one of the driving forces behind today's session. She will speak about knowledge circulation, how ideas, evidence, and experience travel within our movement and beyond. Rueda, the floor is yours. If you're ready, you can share your presentation and start.
Thank you for the kind introduction. Yeah. You can see a screen, I think. Yeah, today I will talk about the knowledge circulation, how knowledge travels and what we lose when it doesn't. Just a second. Yeah, I think it's better. Okay. So I have divided the knowledge into written, documented, experience-based, and cultural. So I had a question. Have you ever solved a problem without knowing that someone elsewhere had already solved like 3 years ago? Yeah, it's actually not a real question. That's a question that all our professors are asking us during the first minutes of our lecture. Everyone is looking to the ceiling, to the walls, and like notice new marks each and every day. So it's actually not a real question. Yeah. What we know about knowledge circulation is that like kind of a bit gossiping, maybe. People were actually transferring circulating their knowledge ahead, but maybe it was not that professional. So yeah. I have this sheen, but I think Paolo's were better. So she had the EYFDM at the center. I want to use that as well. We as Wonka Europe, we have actually different branches. So we have the Eureka, the rural where medicine has been focused, family medicine has been focused on to the rural areas, and the Europrev, the prevention part of the Banca Europe. Us, actually, we should be at the center, as Paula mentioned. The young doctors, the EGPRN, the European General Practice Research Network, which has it's actually the more knowledge-sided one, a little bit more, not more than ours. URACT is the teaching part where actually the professors are more engaged, and the equip part, the quality and safety of Wonka Europe. So, as I said, I divided the knowledge travel circulation into three as written, experience-based, and cultural. So, while we talk about the written one, yeah, there is the guidelines, the protocols, the publications. Most of times we are the most comfortable with while we talk about knowledge. It can be written, it can be shared through webinars, it can be cited in paper, and it travels well. You can see down below one of our workshops in Estonia, which in which people said they were like satisfied while they were leaving. So when we go to the next topic is the experience base, I can say that it's like the clinical intuition, the way we navigate through difficult circumstances, consultations, and how we actually read a room. So this connect always can be with down. It travels through observation, through actually doing it to next to someone and observing someone who is doing that, shadowing the practice. And the cultural one, it is the patient-doctor relationship that looks like what counts as evidence, how much the consultation should take. Actually, this is the deepest layer of the knowledge. This is very hard to transfer unless you experience that in that particular area. The picture in the middle is where I had my exchange. It was I wasn't actually planning to do that exchange. It was a very strict amount of time that I had because I was going to my specialization exam and etc. But I'm very glad to be part of that exchange. And after sharing my knowledge that I gained through that experience in my clinic to like 150 GPs. Um, uh, they were pretty interested. They were very shocked what other doctors were doing in their clinic because we had many things in common because people are in common, sickness are common, but the way we approach the way the amount of the tools that we have and sometimes even though we are in Europe the guidelines we're following are different, so it brought that my mind and as I shared my experiences with them, nobody has ever checked their phone and they were all ears listening to me. That was really shocking because I had previous presentations and nobody was listening that much. So with the last one, it is actually the Dharmascope that they were using during their clinic. I was pretty impressed because we don't have that kind of ability. We actually either diagnose by ourselves with our brightest eyes or we consulted the dermatologist in person because they didn't have to consultate or send them to see a dermatologist always they were like chatting with them to the dermatologist and asking the online consultating, which was quite impressive. And as I tell to my friends, they were like quite impressed with that as well. So, which type of knowledge is carried with which type of EYFDM mechanism? So I put the webinars as I'm not going deep in that much because Paul already mentioned most of them. But yeah, we have webinars and special interest groups. They are mostly documented and written. I wrote them in red because even though it seems that it's only documented or written, they're actually the base and the entry point to the other platforms of EYFDM. So it's also experience-based and cultural. We have bridge projects, congresses, they're also all documented, experience-based and cultural. We have pre-conference and conference forums where we share our experience, our papers, our manuscripts, and which is very enlightening. And also, as Paolo mentioned, we have exchanges, and which is with mentorship and leadership. We have Ascent leadership, Aspire leadership. We have other leaderships below EYFDM as well, but I was a little more familiar with mentorship and leadership of EGPRN because Shema is has got them before, so I have a little more idea about that. So these are the papers that our friends has been shared so far based on their experience. I read them all. Before I was accepted to the EYFDM events coordinator, I was reading all the experiences and I was like, wow, I was shocked, and I actually wasn't sure that I would be able to do that. I was not trusting myself. So, but as soon as I entered the EYFDM, I realized that it's very easy. And now most of my friends in my clinic also do apply to those kind of exchanges. So you'll see a lot Kahramanmaraş in our applications. So there are more and more and more papers. And this is our my first EGPRN experience. It was I have attended many congresses and conferences in Turkey, in both international and national, but EGPRN was quite beyond my experiences. It was really quite academic. These are all the Turkish colleagues of me. Shema was doing her presentation, and Sena, and me with Yeko Burgers. He is a great GP, a professor that I admire. So as we told, we have special interest groups. That's one of them is where actually me and Shema is in the lead group, the digital health and artificial intelligence. There are many different special interest group. I have only included the ones that they are active. And since I have the opportunity to share, I want to share our next coming webinar. So if you're interested, you can attend it on 12th of June. And the barriers. I also want to talk about what I received the most about the questions. So we don't have to speak English that much. And advanced English is actually not been accepted in our sessions, in our conferences and pre-conferences, because our aim is not to be bossy, but we want to engage and we want to come together and share our experiences and circulate our knowledge. So please don't be afraid that if you don't trust your language, you don't have to. And as a personal experience, I can say that once you try, you can improve your language. Otherwise, it will stay in the way that it is and will not improve. And we also need to, it's really hard to write something, I know. It doesn't have to be always documented, but we know that undocumented things, everything which is undocumented vanishes away, and we cannot transfer it to other colleagues and next generations, unfortunately. So last but not least, we want to ask you to document your experience, share it with us, to contribute our exchanges, special interest groups, webinars, bridge projects, and workshops. And I also want to remind you that EYFDM is as a knowledge ecosystem. It's not just a network, but every time you participate, you contribute to a living system of shared learning, sorry. And I also, since Paula mentioned, I deleted that part, Malaga and Paris. I also wanted to include the Wonka Istanbul 2028. We're gonna host it, and all of you are invited. We are started already thinking about the process and preparations. So, yeah, I want to finish my words that knowledge doesn't stop at borders, but it doesn't cross them automatically. It either needs us intentionally. Thank you and happy past World Family Doctors Day.
Thank you so much, Ruveyda. It was really, really inspiring presentation and lots of information, and hopefully it's inspiring for the young doctors from who are in the participants in the Congress. And I really thank you about you put the webinar the poster in your slides, which we are really excited about it. We are working on it together with Ruveyda, one of the lead of our special interest group. So I also put the link in the chat. We would like to see you in that upcoming webinar with Rita Bekassis will be the speaker. And I recently handed the exchange coordinator role, Turkey EYFDM Turkey exchange coordinator role over to you, Rüveyda, and I feel completely at ease.
It's
and
actually events coordinator, Şeyma.
Events coordinator. But I said sorry, not exchange. I'm so sorry. Yes, because of the time. Now it's 1 a.m. right in Denver, so I'm so sorry for that. Yes, event coordinator, and I feel completely at ease and genuinely proud of you. You're doing great. Thank you so much for your efforts. And you mentioned I will check the questionnaire if there are any questions. We would like to have your questions, contributions in the chat. If you have, please write your questions in the chat. So I will ask our distinguished speakers. But
I'm also going to write my phone number. So if anyone has hesitant to ask questions and like publicly, they can send their questions to me.
Thank you so much. You are so kind, Reda. So we have 1 minute left. I would like to ask a quick question. You mentioned dermoscope example from Estonia, which I really inspired. Also, I saw in Sweden, it was really amazing. But they had a coordination with the dermatologist also. But probably in the Estonia case, the family doctors are using it to make it more proper diagnosis and treatment, right?
They actually do take the pictures to make a proper diagnosis, yes, but they also send it to online dermatological consultations. Yeah, that's awesome. That was that I was very impressed with, apparently.
Yes. And do they use any AI assistants in that dermoscope on their phone? Have you realized it?
No AI assistant. Maybe I was a little bit in the rural part. I'm not sure in the central part.
Yeah. Mm-hmm.
But I heard that they were using AI in their daily clinical practice. So
Yeah.
maybe some of them, in my clinic it wasn't, but in like
Mm-hmm.
more developed months,
Widely
maybe.
used. Yeah.
Yeah.
Yeah. Perfect. So we would like to really love to hear your exchange experience soon, very soon, on a paper, hopefully. It will be so inspiring also for all of us. And so we need to continue. I would like to talk a lot with you, but we need to continue with Lisa, our next speaker. And dear Reda, you can stop sharing, and maybe Lisa could make it. And she is joining us from the Netherlands. Lisa Thoman is, I hope I'm pronouncing correctly, is a family physician based in Maastricht, the Netherlands. Please correct me, Lisa, when you
No,
start.
yeah, it's
Start.
correct.
Perfect. And she completed her GP training in 2025. During her training, she spent 2 weeks in Izmir, Turkey, and through the EYFDM, Hippocrates Exchange Program, observing primary care practice and gaining insight into the Turkish healthcare system. She also contributed to the organization of the LOA Conference Exchange 2025 in the Netherlands, where GP trainees were introduced to the Dutch healthcare system. These experiences have strengthened her interest in international collaboration. Lisa, we are looking forward to hearing how the exchange shaped your view of family medicine. Please go ahead. You can share your presentation and start.
Can you see the screen now?
Yes, but we see the all 3 pages per time. Yes, perfect. Maybe you can also start the presentation.
I just did it, but it looks different. Wait, I'm gonna try it again.
Mm-hmm.
I also had some internet problems 1 minute ago, so I dropped out of the Zoom meeting, but I hope
Really.
it's not gonna happen during the presentation.
Let's see.
Let's see.
If it doesn't work, you can also we see yep, we see the screen, whole screen. You can skip you can change the slides. We already see the all presentation. If it's not possible for you to share a
Yeah,
different
it's
presentation, okay.
when I tried it before we started, it was working actually. I don't know why it's not.
And maybe it could be nice you to how can I say that, make smaller the notes parts of the presentation so we can see larger your
Yeah, I know
slide.
what you mean.
I think you can change the presentation mode on the right corner down.
But it's a little bit wait, where is it? Do you still see it? Because I quit my sharing and I do not have the option again to share my presentation.
Now we can't see any presentation, Lisa. If you can't, I will try to arrange.
Right now?
Yes, we can see it. It's the same, but we can continue like this. If it's possible if it is possible you to make larger the slides, it could be better.
I just opened it in like full screen. Can you don't see it like that?
No, unfortunately, I can't see right now the full screen.
Like
Perfect.
this?
Yes, we can continue like this. It's perfect.
Lisa, excuse me for the interruption. At the top, there is like automatic Ausplan, the tick, and you see that presentation modes, like a little presentation, kind of like in like a YouTube icon.
Yeah, I know how to open it in a big screen, and when I press this button in my computer screen, it also opening in a full screen, but you don't see it like that, which is a little bit strange.
Yeah. But totally okay. We can continue, dear Lisa. Don't worry.
And also, I don't see the Zoom screen anymore if I go to my presentation, which is also a little bit strange because before when I opened it, I saw it in like the Zoom screen. So I don't see you if I go to my PowerPoint, but let's just do it like this. So right now you see the presentation, right?
Yes, the first slide of your presentation.
And if I go to the second, does it work?
Yes, it works.
Okay.
Yes, yeah, perfect.
Then we're gonna do it like this. I don't see your faces or any questions, so maybe you should tell me if I have to stop or if there's a question in between my talks. But thank you anyway for inviting me. It's a big honor also to join this online session. Yeah, and little introduction, even though it was given already. I am a GP right now. I graduated in September, but I was part during my specialization part of the LOVA, which is the organization for GP trainees. And in there, I was part of the group for European collaboration. And I got really enthusiastic about this whole exchange from other people who did this exchange. So I also hope to kind of make you enthusiastic about this type of exchange because I think it's a very nice way to broaden your view and your knowledge. So when I had to think about where to go, I thought, okay, I want to go somewhere where hopefully the healthcare is also different, so that I can learn from the primary care in a different country to broaden my horizon also. And I was also really interested in how a different culture, but also religion, has impact on healthcare. So after the exchange was arranged, I went from Maastricht, that's where I live, which is in the south of the Netherlands. I came to Izmir for 2 weeks, to do the exchange. And this is how my program looked like. And special thanks to Demet Merder because she made this this program where I was able to visit many places. And I think because of going to so many healthcare centers, but also visiting the hospital, there was even a symposium organized. I think all these different things made that I got like a broad picture of the Turkish healthcare. And if you would show this in pictures, all the different places, this is kind of a little combination of everything together. And because I, experienced so many different places and I experienced the Turkish healthcare system, right now I want to guide you a little bit through the differences that I experienced. So I want to start with the role of the GP. So what I saw in the beginning, and which was different also, is that in Turkey I saw the primary healthcare system, but also the healthcare that was given in the hospital. And I thought that there was a big gap. There was like a lot of more basic healthcare in the primary care system, and then super specialized care that you are giving in the hospitals. And I was missing a little bit the patients that I see in the Netherlands, like the normal ill patients who are coming with knee pain or abdominal pain, or I don't know, you name it, and they come to the GP in the Netherlands. So for me, there was a quite big gap in between like primary care and also there's super difficult care that you're giving in the hospitals, for example, in the palliative care units. And I think that this difference is mainly because in the Netherlands, we, as a GP, we are a gatekeeper. So the patients, they come to the GP for any health complaint. So every patient has to go to their GP if they have any question or any complaints regarding to health. And in Turkey, the patients can also go directly to the specialist. So I think this is the reason why I was missing a little bit these everyday ill patients. And another big difference is that in Turkey you have more the preventive healthcare. I saw that you're doing also the follow-up of the pregnancies for the children, the growth of the children. You also do all the vaccinations, and all these more preventive medicine is done by another institute in the Netherlands. So that's not the role of the GPs in the Netherlands. And another thing I think that's also much different is in the Netherlands we have kind of specialized nurses, and they see their own patients, supervised by the GPs, and they do a lot of things. They do mainly cardiovascular risk management, but they also treat the diabetes patients. They treat patients with COPD, and they are also allowed to prescribe medications. And so these repeated medications is also something that we don't really do as a GP. They either just order it and we agree, and they can get the prescriptions, or the nurses, they do their follow-ups every few months or every year. Then I want to go to the next slide, and I think this is quite like funny difference. I visited one last year in GP practice that was based practice in Turkey or in the Netherlands is in a church or a mosque, but it's kind of a funny way already how the practices can be organized. Other than that, in Turkey there is way much more patients for every GP. I heard that it would be around 3,000 to 5,000 patients, and in the Netherlands it's for every GP 2,100 more or less. But we have practices where the GPs are combined, so there will be more patients for every practice, but for every doctor there will be this amount of patients. And I think that also results in the fact that in Turkey there's like super brief consultation from what I've seen, like patients come in and out and it goes very fast. And the consultation sometimes takes like very short time, whereas in the Netherlands we do mostly 15-minute consultations. And if people have psychological problems, we even do 20 or 30 minutes. So we have, more time. And for me, this 15 minutes sometimes already feels short. So it surprised me that you can do it in like a few minutes in Turkey. Another difference is that in the Netherlands, we do the home visits actually daily. So the patients who are coming to your GP, but especially the elderly who are not able to come to the GP, we go to their houses, and it's just a part of the daily work of the GPs. And also we organized with all the GPs in the Netherlands that during the evening, weekend and night times, there's something different than the emergency room, but kind of an emergency room for GP health related problems. So also in the evening and night times, if patients have any problems, the first place to go is the GP. Then there was something that I really liked in the Turkish system, which is the İnabis, if I pronounce it correctly. I think that's really good that in Turkey there exists this kind of system where patients have all their medical information together in one system, and that you can actually also share this system among all the doctors. So it doesn't matter where you go, from what I saw, as long as the patient kind of agreed on it, then anyone can see this information. And this is something that I actually really miss in the Netherlands, because every GP has their own medical records, but also the hospital have their own medical record, and we have to actually send each other letters with the information. But I miss sometimes because you know there's also medical information that's missing. This is something, this İnabis system, would be nice if we would have something like this in the Netherlands. Then some other observations that I did. One thing, what was surprising for me is that it felt like there was some kind of restrictions that you have as GPs in Turkey. For example, diabetes patients, from what I heard, you are, for example, allowed to only give certain tablets in the treatment. And if there is need for insulin treatment, for example, patients will be sent to the specialist. And I think it's also because in the Netherlands we have a lot of guidelines, especially for the Dutch GPs. So we do actually also in the treatment of diabetes, we even prescribe the insulin and actually the full amount of medication that you can give for diabetes. And only if after these treatments it's getting more difficult, or you're not able to get the patients into normal glucose values, then we send them to the specialists in the hospital. Another maybe a little bit funny thing is I felt like the privacy in Turkey is also much different. So there will be consultations with the doors open while there's other people sitting in the waiting room. So that felt a little bit less for me. But on the other hand, in the Netherlands, it could be too much also, because the rules are so strict that it also makes your work sometimes a little bit more difficult. For example, if you want to share information with other healthcare givers, you're not allowed to do that without the agreement of the patient. It should be something a little bit in between. Another thing is that I think it's quite normal in Turkey to do like routine blood monitoring. So healthy patients who come and ask for like general checkup. I think in the Netherlands, we have more this kind of way to do tests more based on the symptoms that they have. And the other three things I wrote down, that there's definitely a difference in antibiotic use, which is higher in Turkey regarding to the Netherlands, and which was also interesting for me to see that there's a lot of prescription needed also for over-the-counter medication in Turkey, because for the patient it's cheaper if they get a prescription, which also makes that they come to the doctor more often for maybe medication that they could also just buy. And the last point that I wrote down in there, that the family is super important as a caregiver. I think it's also a really good thing in Turkey, because I saw that the family members have a really big role and they take a very big part in taking care of the patients, also in the hospital, but also in the houses. I think in the Netherlands, I mean, of course, we also do take care of our family members, but in not this big extent. I think there will be more like nursing homes or nurses that would work, for example, in the hospital to do this kind of work. So I think it was really nice to see that family is taking this role also. I also think that's something that could maybe something that we can learn from you. Then this part really stood out to me. So I was a few days on the palliative care unit, and I would expect, before I came there, I was expecting to see super ill patients, of course, who are in their end of life time, and I would expect, from how I would know it in the Netherlands, that there would be treatments that would be focused on comfort and also quality of life. And what I saw was actually severely ill, sick patients, where the healthcare was more focused on really cure and also treatment. So I saw a lot of invasive interventions, with tubes, feedings, tracheostomas. So it felt really like an intensive care or medium care. I think, I'm not sure if that's fully correct, but I think the palliative care in general in Turkey is more hospital-based, whereas in the Netherlands, I think we do the most palliative care as GPs, but in home settings. So a lot of patients will be at home and we provide the medication and everything in the houses, or patients will go to a hospice. But of course, there's also palliative care given in the hospitals or in nursing homes. What I saw is that in Turkey, also in the severely ill, sick patients, all the treatments will be done. So also resuscitation is obligatory, which was interesting to me because I am more used to a system where treatment limitations are super common. So either from doctor's perspective or from the request from a patient, they can ask like, I don't want to get resuscitation, or I don't want to go to the ICU, or I don't want antibiotics and if I get an urinary tract infection, which I did type of healthcare. And of course, if you don't know, there's also difference that in the Netherlands, under strict rules though, but it's allowed to give euthanasia and also palliative sedation in the palliative care. Then another really important difference, the lunch. On the right side, you see typical Dutch lunch, slice of bread with some cheese. And then I found out this Turkish lunch, and of course I know it was a little bit different because I was there and I was there as a guest, but the food was perfect. At any place I was going to, they treated me super nice, and it was really a warm welcome in this way. So this was one day in a primary healthcare system with Kisir party, if I say it correctly. There was also a lot of food in the hospitals. Even like, the open kitchens in the hospital, they provide nice food, but there was also whole lunch homemade by all the people from the palliative care unit. There was also a lot of lunch meetings outside the hospital, so I was taken to a lot of nice places. And you can see the difference between the Dutch lunch and the Turkish lunch. I know what to choose now. Then they also organized a social program. I mean, they really made me, not only show me the hospital and the healthcare centers, but also everything that Izmir has to offer. So I don't know if this video is gonna work, if you can see it also. Yeah, I guess a typical Turkish night, and for me, really, really fun. What I took home in the end. So of course, with being 2 weeks in Izmir, I got like a better understanding of a different healthcare system, the Turkish healthcare system. And I learned that also across cultures, across countries, the healthcare expectations from patients, they vary. And that also these differences are shaped by different things. So it is, I think, cultural, but also from religion background, but also resources and social values. And I think in general, it gives me more understanding if there will be patients in my room with different backgrounds. That I can understand them a little bit better, and then I'm also more open-minded to them, knowing how their healthcare might be organized in their home country. And then last but not least, of course, all the good memories of the Turkish hospitality and the delicious food, and of course, the whole culture. So I want to close with one final question for you. After all the food that I got, I was a little bit afraid, like, okay, what is my weight gonna do? So quiz question, how much weight did I gain during the exchange? And I will give you the answer already, because I didn't change any weight, even though I eat a lot. I also walked a lot. I walked a lot from the place where I stayed to the hospital. So I was kind of happy that I didn't gain like kilograms. So I want to close with that. And also, çok teşekkürler. And if there's any question, I'm happy to hear them.
Thank you so much, Lisa. It sounds that you had really, really great experience in Izmir. And I would also thank you to the host committee that they were. You seem really happy. That I'm so happy to see that. It was really wonderful to hear about your exchange. and I hope and I see that you return great memories. Unfortunately, we no time left for questions, but if you have questions, maybe at the end of the session we can have. But I hope your experience encourages our colleagues in this room also to do a Hippocrates exchange. And congratulations again on winning the exchange award. It is
Thank
truly
you.
meaningful. We sincerely encourage young family doctors to join the Hippocrates or the other exchange programs. And I would highly recommend the Hippocrates exchange program to get the exact taste of the system that you would like to see. And thank you for again choosing Turkey. I had a few questions, but your presentations slides were really clear that I got all the answers. So I need to continue with Hande. Thank you so much again, Denize. Hande Nur Erolmez is a family medicine resident physician based in Istanbul, Turkey. Alongside her clinical training, she's actively engaged in academic research with a particular focus on nutritional status, malnutrition, and muscle strength loss in oncology patients. And during her residency, she has contributed to several publications in international peer-reviewed journals and has presented her research at national and international congresses. Dr. Erolmez is also involved in international primary care networks and participated in WONCA EYFDM primary care show exchange program in the United Kingdom last year, and where she observed primary care practices and healthcare organization within the UK system. Charlotte mentioned about a little, and Hande will talk about the primary healthcare system in UK today. In addition to her medical training, she's currently pursuing on MMBA at Galatasaray University, reflecting her interest in healthcare management and interdisciplinary development in medicine. She will share the experiences from the CGP Primary Care Show Exchange program, and she will do her presentation in Turkish language because we have also Turkish residents, and it could be more beneficial for them to be inspired. And Hande, over to you. You can share. You already shared. You can share your presentation and start.
Hello, everyone. Thanks to Dr. Şeyma Handan Akyan to share my full CV with you. I'm not sure, should I talk in Turkish or English? As she said, my presentation will be in Turkish because of the Turkish students, but I prepared my presentation in English. So what should I do?
You can continue in Turkish, but it is great to have your English presentation also, presentation English, but you can continue.
Can you see it now? Can you see it now?
Could you try again? Yes, I can see your presentation right now.
Okay.
Yes, full screen, as a full screen. Now it's okay.
Okay, thank you. Türkçe devam etmem söylendiği için Türkçe devam edeceğim. İngilizce hazırlamıştım. Merhaba herkese. İsmim Hande Erönmez. Ümraniye Eğitim Araştırma Hastanesi'nde 2. yıl aile hekim asistanıyım. Benim hikayem EYFDM'le aslında kendim exchange yapma isteğimi bir hocama danışmamla başladı. Ben yurt dışında bir eğitime katılmak istediğimi söylediğimde bu şekilde kongrelerde aslında haberdar olduğu için Elif hocam bana EYFDM'in sayfasını takip etmemi söyledi. Bu şekilde de benim aslında bu sistemin içine dahil oluşum başlamış oldu. Daha asistanlığımın ilk aylarıydı. Ve ben ilk gördüğüm ve bana uygun olduğunu düşündüğüm fırsatlardan birine hemen başvurdum. Birazcık daha burada nasıl giderimi düşünen arkadaşlar için süreci nasıl yönettiğimden bahsederek başlamak istedim. Öncelikle bir motivasyon mektubu ve başvuru için gerekli istenen aslında ve duyurularda çok güzel bir şekilde belirtilen süreçlerle başladım. Kendim benim başvurduğum programda mektup isteniyordu. Biraz fazla hatta e-mail göndermiş olabilirim. Çok heyecanlıydım o dönemde. Daha önceki konuşmacı arkadaşların özellikle Rüveydan bahsettiği gibi insan birazcık gergin olabiliyor. Yapabilecek miyim, yapabilir miyim, acaba nasıl devam edecek diye. Ama süreç benim için oldukça hem takım sayesinde hem de oradaki host eden hocalarımız sayesinde çok güzel geçti. Kabul edildiğimin mailini aldıktan sonra aynı gün içinde hatta Dr. Katie Davies benimle iletişime geçti ve bütün süreci aslında birlikte organize ettik. Hem nasıl başlayacağımdan, nasıl, nerede kalacağımdan, konferansa katılım günümüzden, hatta hangi otobüse binip ineceğime kadar birlikte planladık. Daha önce pek çok kez İngiltere'de bulunmuş olmama rağmen oldukça güzel bir planlamayla çok daha pürüzsüz bir süreç geçirdim. Sonrasında vize ve diğer fırsatları da, diğer yapmam gerekenleri de ayarladıktan sonra yolculuğum başladı. 4 step'te aslında özetleyebilirim exchange programı dediğimizin ne olduğunu. Zaten önceki arkadaşlar da ve bütün katılımcılar çok güzel paylaştılar. Benim sürecimde EYFDM Onka Exchange Program diye geçiyordu. Pre-konferans exchange'i 2 günlük bir süreçti. Sonrasında konferansa katılım vardı aslında. 2 gün öncesinden İngiltere'de konferansın olduğu şehirden farklı bir şehirde, Bowland Medical Practice Manchester'da 2 günlük bir gözlem sürecim vardı. Sonrasında da Birmingham'da 2 günlük bir konferans katılımımız oldu. Oldukça da keyifli geçti bütün süreç. Gittiğim yer, bahsettiğim Bowland Medical Practice İngiltere'de GP'lerin, aile hekimlerinin, hemşirelerin, fizyoterapistlerin ve eczacıların birlikte çalıştığı, aslında Türkiye'de karşılığı aile sağlığı merkezi ya da toplum sağlığı merkezi olabilecek böyle küçük mahalle arası bir sağlık birimiydi. Burada aynı bizim sistemimize benzer bir şekilde ki önümüzdeki slaytlarda ikisini birlikte karşılaştıracağım. Koruyucu hekimlik, aşılama ve diğer aslında temel sağlık hizmetleri birinci basamak sağlanıyordu. Bazı böyle bizden farklı gördüm ama büyük oranda da aynı gördüm şeyler keşfettim orada. Orada birlikte çalıştım ve beni karşılayan ekibi görüyorsunuz. Yanımdaki bana göre sağ taraftaki Dr. Katie Davies, diğerleri de aile sağlığı merkezinde çalışan ebe, doktor ve hemşire ekibiydi. Oldukça sıcak ve tatlı bir ortamdı benim için. Aslında Türkiye ve İngiltere aile hekimliği sistemini karşılaştırdığım bir süreçti benim için baştan sona bu değişim süreci macerası. Tam da sistemin ve programın hedeflediği şeyi yaşadım ben orada. Türkiye ile İngiltere arasında çok dediğim gibi benzer ama aynı zamanda farklı şeyler mevcut. Türkiye'de açık bir şekilde bütün hastalar hepimizin bildiği gibi şeye gidebilirken doktora, uzman doktora, orada daha çok öncesinde herkes GP'sine yani kendi aile hekimine gittikten sonra uzmana yönlendirebiliyor. Yani bir sevk sistemleri var ve öncelikli olarak aslında bütün hastalar öncelikle kendi aile hekimini, GP'sini görmeyi de tercih ediyor ve istiyor. Bizim aslında kendi hasta grubumuzda yaşadığımız bir challenge'dır. Hastalar önce uzmana gitmek isteyebiliyor bazen. Orada daha çok tercih ediliyor GP. Ve hastalar da bundan daha memnun. Oradaki surgery'lerin Türkiye'deki karşılığı bahsettiğim gibi aile sağlığı merkezleri 2010'dan beri verilen ismiyle. Onlar daha kalabalık bir popülasyona hizmet veriyorlar. Ve NHS sisteminden aslında kendi ödeneklerini alıyorlar. Biz daha küçük aktif sahada aile hekimliği yapan arkadaşlar daha net sayılar bilirler. Ben daha o fırsatı bulamadım uzmanlık öğrencisi olduğum için. Daha küçük bir gruba hizmet verirken onlar daha geniş bir popülasyona hizmet veriyorlar. Ama buna rağmen daha yoğun olması beklenen bir sistemde daha uzun hasta görme süreleri ve daha az hasta görme sayıları var günlük. Bizim hasta volümümüz çok daha yüksek onlara göre aile sağlığı merkezlerinde. Onların yine dijital kayıt tuttukları bir sistemleri var. Biz gerçekten örnek gösterilecek e-nabız gibi bir sisteme sahibiz. Oldukça detaylı. Onların sistemleri biraz daha bana bizim hastanelerde kullandığımız dijital kayıtlama sistemlerini andırdı. Ve hani kullanım olarak da benimle paylaştıkları kadarıyla hani hasta mahremiyetini koruyacak şekilde incelediğim kadarıyla biraz daha bizim hastane kullandığımız sisteme benziyor onların sistemleri. Bizim e-nabız kadar gelişmiş böyle bir sistem benim gözüme çarpmadı. Yine bahsettiğim şekilde fund edilen şeyleri değişiyordu sistemlerimiz iki ülke arasında. Manchester'da 2 gün konakladıktan sonra Birmingham'a geçtik. Orada da Primary Care Show'a katılma fırsatı buldum. Bu arada ilk yaptığımız bu aile sağlığı merkezi benzeri süreçte hepimiz farklı Family Care Center'lardaydık. Bütün değişim exchange ekibi olarak birbirimizi ilk Primary Care Show'da görme fırsatımız oldu. Farklı şehirlerden gelen çok fazla exchanger vardı. Birazdan zaten fotoğrafları da göstereceğim. Primary Care Show İngiltere'nin en büyük aslında birinci basamak kongrelerinden birisi. Bizim kongrelerimize çok benzer bir düzeni vardı. Uluslararası bir katılımcı ağı vardı ama özellikle olarak İngiltere'de çalışan GP'lere yönelik tanıtımlar yapan firmalar çoğunluktaydı. Eğitim kısmı çok dolgundu. Çok fazla konuda katılınabilecek sessionlar, eğitim saatleri mevcuttu. Güzel bir network sağlanabiliyordu orada. Hani ben herkesin çok keyif aldığını ve alarak katıldığını düşünüyorum. Çünkü hem katılımcı sayısı çok yüksekti kongreye. Yani 6.000'den fazla katılım olarak kağıt üstünde görünüyor. Gerçekten de hissediliyordu. Hem de kongrenin yapıldığı, Primary Care Show'un yapıldığı kompleks de çok oldukça büyüktü ve bunu kaldırabilir düzeydeydi. Oldukça da verimli geçti. Burada ben aynı zamanda bu firmalar yani çok fazla katılımcı olması sayesinde son teknoloji sağlık da kullanılan son teknoloji cihazları görme fırsatı olduk. Şeyma Hocam'ın da başta bahsettiği gibi genellikle çalışmalarımı yaptığım alanlarda kullandığımız hocalarımızla birlikte bu biyoelektrik empedans analizi cihazlarının bile çok daha yeni türlerini ben orada görme fırsatı yakaladım. Yatak başı yapılabilen ölçüm cihazlarını orada görme fırsatı yakaladım. Çok kısa bir süre sonra zaten Türkiye'de kongrelerde de aynılarını gördüm. Bu açıdan bu tecrübe benim için oldukça aslında faydalı geçti. Sonrasında sosyal program da keyifliydi. Türkiye'den katılan 4 arkadaştık. Yine farklı ülkelerden gelen İspanya'dan, Hırvatistan'dan, Avrupa'nın çeşitli ülkelerinden oldukça birbiriyle iyi anlaşan ve keyifli bir ekip haline geldik. Hala da arada haberleşiyoruz. Orada da birlikte güzel vakit geçirmiştik arkadaşlarımızla. Burada yanımda Amy Thompson ve Katie Davies var. İkisi Exchange Coordinator olarak çalışıyorlar İngiltere EYFDM bünyesinde. Oldukça da ilgililerdi bize karşı. Hem kongre sürecinde hem de sonrasında, öncesinde her zaman iletişimdeydik. Daha önce de hem Rüveyda Hoca'nın sunumunda gördüğüm için mutlu oldum. Hem de benim bu sunumda moderatör olarak görmekten çok mutlu olduğum sunum haberini aldıktan sonra Şeyma Hocam'ın yazısına da atıfta bulundum. Ondan görüp hemen ben de yazmalıyım diye düşündüm. Exchange programının sürecini anlattım. Bir yazımız oldu. Bu da çok mutlu ediyor beni baktıkça. Çünkü hani bazı hatıralar yazıda kalmadığı sürece, insan paylaşmadığı sürece unutulabilir. Ama bu şekilde bir yazıya toparlamak, benden sonra bunu yapmak isteyen bütün meslektaşlarıma da bir fikir verir diye çok mutlu oluyorum. Demin Rüveyda'nın sunumunda da görünce çok çok mutlu oldum Rüveyda hocamı. Bu şekilde uluslararası deneyimlere katılmanın önemini zaten ilk konuşmadan itibaren herkes, özellikle advokasi düzeyinde de ya da global yani uluslararası bir network sağlamak adına da herkes çok fazlaca değindi. Ben de çok kıymetli buluyorum. Aynı zamanda bu tarz böyle kongrelerdeki session'larda bunun paylaşılmasını da hem asistan bizim gibi arkadaşlar adına, hem genç uzmanlar adına, hem de aslında bu session'a katılıp dinleyenler hocalar adına da çok faydalı buluyorum. Çünkü beni de bu şekilde haberdar eden bir hocamdı. Ben nereden başlayacağımı bilemiyorken o kongrelerde EYFDM oturumlarını gördüğü için bana takip etmemi söyledi. Ve iyi ki de söylemiş. Ben çok memnunum bu hem değişim programını yaptığım için hem de sonrasındaki süreçte bu şekilde bağlantı içinde kalabildiğimiz için. Çünkü oldukça faydalı geçtiğini düşünüyorum. Asistanlık sürecime çok fazla katkı sağladığını düşünüyorum. Bu da yine konferansa katılan arkadaşlarla çektirdiğimiz bir fotoğraf. Bu zaten oturumun amacıydı. Bütün değişim programları küçük gibi görünse de hepimiz için oldukça büyük şeyler aslında doğuruyor. Ben son konuşmacı olarak süremi biraz daha faydalı mı verimli mi kullandım bilmiyorum ama umarım kullanabilmişimdir.
Çok teşekkürler Hande Hocam. Evet, gayet güzeldi. 2 dakikamız da var hatta. Sorular olan arkadaşlar varsa özellikle exchange deneyimiyle alakalı Hande Hocamızı çok memnun oluruz. Ben de çok dolu güzel bir exchange görüyorum. Okudum da yazını, çok da güzel olmuş. Kesinlikle ben de katılıyorum sana. Anıları böyle bir yazıyla taşlandırmak diyeyim çok kıymetli. Benim için de bir anı oluyor. Hatta orada gittiğim hostumla birlikte yazmak da çok aşırı kıymetli. Sen Keti ile birlikte yazmışsın. Çok tebrik ediyorum gerçekten o eforun için. Ve diğer gelecek arkadaşları, genç arkadaşları da cesaretlendirdiğin için çok teşekkür ediyorum Hande.
Ben de çok teşekkür ediyorum. Bu yolları sizler açıyorsunuz. Biz de peşinden böyle hızlıca. Ama herkesin yazmasını dilerim bu arada. Hatta yani şu an hani Türkçe'de konuştuğumuz için biraz daha vaktimi de kullanacağım. Yani şöyle bir kültürde olursa bence çok güzel olur. Ya Türkiye'den gelen bütün exchange öğrencileri yazı yazıyor. Çok güzel oluyor diye böyle bir aslında yapabiliriz yani. Çok da güzel olur bence. Ve hepimizin aslında bir paylaşacak bir şeyi olur. Hani her exchange'e gidenin ben yazmasını çok böyle güzel destekliyorum. Okumayı da çok isterim keyifle hepinizin yazılarını.
Kesinlikle %100 katılıyorum. Kabul eden hani dergideki hocalarımıza, editör hocalarımıza de çok ayrı bir teşekkür etmek istiyorum. O da güzel, kıymetli bizim için. Bize cesaretlendiriyor ve gelecek inşallah arkadaşları da cesaretlendireceğine inanıyoruz. Bu alışkanlığı devam ettirmen çok kıymetli. Arkadaşlara da güzel bir öneri. Onun için çok tebrik ve teşekkür ediyorum. Şu an süremizi süre olarak aslında doldurduk. Yine soru olursa dediğim gibi sonunda araya biraz sarkacağız. Bir 17 dakika kadar sarkacağız. Çünkü önceki sunumlardan gelen şeylerle, aradaki sarkmalarla EYFDM tanıtım oturumuna geçireceğiz şimdi. Hande çok sağ olasın. Çok teşekkür ediyorum. Tekrardan çok memnun oldum.
Teşekkür ediyorum. Ben de çok memnun oldum.
Belki küçük bir İngilizce devam edeyim. For our final presentation, I would like to invite the EYFDM Turkey team to the stage together. Dr. Rüveyda Nur Ağırbaş, Dr. Hande Büyükdağnam, Dr. Gülşah Onur, and Dr. Büşra Bilik Sezer. The team's exchange awards and image and event officers and coordinators, they will introduce themselves and they will give us an introduction to EYFDM, and this presentation will be delivered in Turkish. To our international guests online, thank you for your understanding. And you have already met Dr. Rüveyda and our exchange, the event coordinator. Let me briefly introduce her teammates. Dr. Hande Büyükdağnam is a family medicine physician and the EYFDM Turkey image coordinator. She is newly a family medicine specialist. She has taken part in EYFDM conference, exchange, Wonka conferences, and also the LOVA Congress in Netherlands. And Dr. Gülşah Onur is family medicine specialist. She is a wards coordinator from Bushbulanık District Health Directorate. And as I said, the EYFDM Turkey Awards and Bursaries coordinator. Dr. Büşra Bilik Sezer, she's a magician. She's making real our exchange dreams. She is a family medicine specialist and a member of the EYFDM Turkey team. She's serving as a the real exchange coordinator. And together they will give us an overview of EYFDM, its structure, its opportunities, and how we can get involved. The floor is yours, girls.
Herkese merhaba. Ekranımı görebiliyor musunuz?
Evet canım, görebiliyoruz.
Tamam, harika. Ben Büşra Bilik Sezer, Şeyma'nın da söylediği gibi sevgili Şeyma'nın. Iğdır Tuzluca ilçesinde aile hekim uzmanlığı olarak görev yapıyorum. Öncelikle bu sunum için ve bu oturum için emeği olan herkese, bütün meslektaşlarıma, saygıdeğer hocalarıma teşekkür ediyorum. Biz de EYFDM'yi anlatacağız aslında. Öncelikle EYFDM nedir, yol haritamız nedir bunları bahsetmek istiyorum. Tabii ki ondan önce ekibimizi göstermek istiyorum. Kim EYFDM Türkiye ekibi? Ekin Dikmen Türkiye temsilcimiz bizim. Ben yeni olarak başladım aslında. Daha bir yılımı bile doldurmadım. Değişim koordinatörüyüm. Sevgili Gülşah
Araya
ödüller...
giriyorum ama slide ilerlemiyor şu an bizde.
Aa,
İlk slide'da kaldı.
şöyle yapalım. Kusura bakmayın. Tekrardan paylaşacağım. Böyle gitsem peki sorun olur mu sizler için?
Yok, sıkıntı olmaz.
Tamam.
İleride.
Tamamdır. Tekrardan o zaman EYFDM Türkiye günü görselle anlatayım bir. Ekin Dikmen Türkiye temsilcimiz. Ben değişim koordinatörüyüm. Sevgili Gülşah ödüller ve burslar koordinatörü. Rüveyda yine benim gibi yeni ekipten etkinlikler ve etkinlikler koordinatörü. Sevgili Hande imaj koordinatörümüz ve sevgili Melike de kampanya ve politika koordinatörü.
Sen de
Yani
değişimi benim
çerçevede...
gibi deyince sen de exchange diyeceksin
Aynen.
diye bir korktum.
Evet,
Evet, bir
tamam oldu.
sürçtü. Evet. Çerçevelerden de anlayacağınız üzere açıkçası üçümüz ekip biraz değişti. 6 kişi ekipten 3 kişi bu sene yeni başladık. Tabii ki eski ekibimizi anmadan olmaz bu süreçte. Emekleri çok büyük ki sevgili Şeyma'nın her yerde görüyoruz. Gerçekten ülkemizin gururu. Benim de ayrıca idolüm olan birisi. Sevgili Mehmet benden önceki değişim koordinatörümüzdü. Sevgili Şeyma etkinlik koordinatörümüzdü ve sevgili İkbal de kampanya politika koordinatörümüzdü. Onlar da ülkemizin şu an EYFDM'in içinde resmi olarak olmasalardı her zaman desteğini hissettiğimiz meslektaşlarımız açıkçası. Öncelikle WONCA'dan başlayalım. World Organization of National College. Burada yani 1970 yılında kurulmuş, günümüze 150 ülkenin ve bölge faaliyetlerini gösteren 130'dan fazla üyenin olduğu bir organizasyon ekibi bu. 600 binden fazla aile hekimini temsil ediyor. Biz buradaki Avrupa kolundayız. 42 ülke ve 49 üye kuruluşu var burada. WONCA'nın çalışma grupları, dernekleri var, alt kuruluşları var. Bunlardan öncelikle Europrev'den başlayacak olursak bu koruyucu hekimlik ve sağlığın geliştirilmesi üzerine kurulan bir kuruluş. Europe kırsal sağlık ve kırsal alandaki sağlık hizmetlerinin üzerine kurulu. EURAX daha çok aile hekimliği eğitimi üzerine kurulu. EGPRN birinci basamaktaki araştırmalar üzerine kurulu. EYFDM bizim içinde bulunduğumuz genç aile hekimleri üzerine kurulu bir kuruluş. EQUIP ise kalite geliştirme ve hasta güvenliği açısından kurulmuş bir kuruluş. Avrupa Genç Aile Hekimleri hareketine geçecek olursak özellikle çok fazla karıştırılıyor. EYFDM, EYFDM, EFDM çok karışıyor. O yüzden bu ikonik slaytımızı koyduk. 2004 WONCA Europe Amsterdam'da ilk başlıyor. Daha sonra 2005 ve 2006'da da artık bunun WONCA Europe olarak Coast'ta adımları kuruluyor, temelleri kuruluyor. İlk başta Vasco da Gama olarak Doktor von Sips tarafından başlatılan bir hareket aslında. Böyle bir şeyin olması gerektiğini öne atan. Zaten önceden EYFDM Vasco da Gama olarak başlamıştı. Daha sonra değişti adı. Hipokrates oldu değişim açısından. Peki Avrupa Genç Aile Hekimleri Hareketi ne demek? Bu EYFDM'nin açılımındaki gördüğümüz. Bunlar aile hekimliği asistanları ve uzmanlığın ilk 5 yılın içindeki olan herkes genç aile hekimi olarak sınıflandırılıyor. Ayrıca bir üyelik vesaire gerekmiyor. Direkt kendiniz uzmanlık eğitiminin içindeyken veya uzmanlık sonrası ilk 5 yıl içindeyseniz bu tanımın içinde oluyorsunuz. Wonka'da belli bölgelerin, biz Avrupa bölgesinde EYFDM ama diğer kıtalarda baktığımızda işte Kuzey Amerika'da Polaris, Güney'de Vainaka'yı görebiliyoruz. Afrika'da Afribon gibi isimler alıyor. EYFDM'in temel prensiplerine bakacak olursak ulusal ve uluslararası düzeyde Avrupalı aile hekimlerinin sesi olmak aslında. Avrupa genelinde eğitim araştırmalarının olanaklarını geliştirmek, mesleki dayanışma yapabilecekleri, birbiriyle tanışabilecekleri, network kurabilecekleri bir ortam sağlayabilmek. Aile hekimliği disiplinini desteklemek ve tıp dünyasında pozisyonu güçlendirmek aslında. Daha önceki oturumlardan da aslında çok kıymetli bilgiler aldık. Tabii ki üzerinden geçiyoruz yine. EYFDM açısından baktığımızda konferans değişimleri olacak. Bunları zaten detaylı bir şekilde anlatacağım. Konferans öncesi değişimler var. Hipokrat değişimleri var. FM360 değişimleri var. Ödüller ve burs değişimleri oluyor orada. Burslar oluyor. EYFDM'in alt kolları var. Burada özellikle bahsetmek isteyeceğim. Türkiye'de gerçekten yani bayrağı taşıyan ekibimizde sevgili Şeyma, sevgili Gülşah ve sevgili Rüveyda'nın da olduğu Digital Health üzerinde bir special grupla var. Alt gruplar bizim için aslında en önemli söyleyebileceğim. Special interest gruplarda ilginizi çeken gruplara bakaraktan herhangi birisine girebiliyorsunuz ve onlarla çalışma fırsatı bulabiliyorsunuz. Ve diğer ülkelerde bu durumlar nasıl diye bunun bilgi akışı olabiliyor. Yani ben sadece Türkiye'den olduğu için özellikle dijital health'e biraz daha torpil geçiyorum açıkçası ama diğer isimleri de görüyorsunuz zaten burada. Bunlar değişimlerde EYFDM'nin Türkiye'de yaptığı değişimler veya yurt dışına gönderdiği değişimlerle alakalı görsellerimiz açıkçası. TÜEK Exchange'deki fotoğrafları görüyorsunuz. 2024 yılındaki Edirne'de yapılan. Yine 2025'te yapılan fotoğraflar bunlarda. Yurt dışından çok fazla değişim öğrencisi alıyoruz ve bunlarla da kontaklar kuruyoruz. Yurt dışına gittiğimizde kontaklarımız oluyor. Artık gerçekten bir aile formatına dönüşüyor bu ilişkiler. 2026'da da yine TAEK Exchange yapıldı. Bu Wonka Europe Konferansı 2024'te Dublin'deki fotoğraflar. Değişime gelen arkadaşlarımız daha sonra Dublin'e gittiğinde onlarla birlikte aileden birisini görmüş edasıyla toplanmaları oluyor özel olarak da. Çok güzel bir duygu açıkçası. Yine Wonka Lisbon'da, Lovah'da 2024'te mesela sevgili Gülşah ve Luis'in denk gelmesi ve daha sonrasında Wonka Lisbon'da denk gelmeleri çok güzel oldu ve üzerine Luis Türkiye'ye değişime geldi ve orada ödül kazandı. Bu da en son Estonya'daki değişimden, forum değişiminden fotoğraflar. Şimdi asıl değişim koordinatör olarak kendi bölüme gelecek olursam değişimler kaça ayrılıyor? İkiye ayrılıyor. Uluslararası değişimler ve uluslararası değişim programlarına bakacak olursak konferans değişimleri öncelikle. Bu konferanslar öncesinde 2-7 gün arasında olan bir değişim. Konferans öncesi talepler oluşuyor ve Avrupa'nın dört bir yanından genç aile hekimlerinin katılımıyla gerçekleşiyor. Oradaki ev sahibi ülkenin aile hekim sistemi tanıtımı oluyor. Hastane ve ASM ziyaretleri, sosyal programlar oluyor. Daha önceki 2024'te olanları görüyorsunuz zaten. Bu Avusturya'da 8. EYFDM forumundaki değişimde sevgili Şeyma Anda'nın gittiği, İrlanda Wonka'da yine aynı şekilde. Lova benim için çok anlamlıydı çünkü EYFDM'le buluşma benim burada başladı. Ben de sosyal medyada gördüğüm değişim sonrası Lova başvurmuştum ve orada gitmeye hak kazanmıştım. Daha sonrası bu ekibin içinde olmam gerekiyor hissettirdi bana. Çok güzel bir deneyimdi. Müthiş fırsatlar, müthiş networkler oluştu kendi adıma. Ve sonrasında şu an EYFDM ekibinin içinde oluyorum. Oluyor oluşum benim için çok heyecan verici. O yüzden hani herkese bu süreci tatmasını istiyorum. Çünkü bir kere tadan kopamıyor açıkçası. Ki sevgili Hande'nin de bahsettiği gibi. Bosna Hersek'te de yine 2024'te değişimden arkadaşlarımız gitti. Katılımlarımız çok oluyor açıkçası ve çok mutlu oluyoruz bu süreçte. 2025'te de hakeza öyle ki 2026'ın duyurusunu da yaptık. İngiltere değişimde sevgili Hande'nin de katıldığı değişim. Europa Ev yine oradaki değişimden fotoğraflar ve TAEK'teki fotoğraflarımız. Yine TAEK. Uluslararası değişimlerde bir ayakta Hipokrat değişimi. Hipokrat değişimi Avrupa'daki değişim. Avrupa özelinde olan bir değişim aslında. Bu da yaklaşık 2 hafta süreyle oluyor. Avrupa içinde ev sahibi aktif ülkeler Avusturya, Bosna, Çek Cumhuriyeti, Almanya, İtalya, Norveç, Hollanda şeklinde gidiyor aslında liste. E, Burada 2 hafta boyunca orada sağlık sistemini gözlemleme fırsatınız oluyor. Hipokrat değişimimiz daha önce de bahsettiğim gibi Luis'in İspanya'dan Türkiye'ye gelişi aslında İstanbul'da exchange'ini yaptı. Daha sonra bizlerle kontak çok iyi olduğu için Hollanda'da denk geldiğimiz için açıkçası o Hollanda'daki buluştuğu ekiple tekrar buluşmak istedik ki sağ olsun Ankara'ya, İzmir'e ziyaretleri oldu. Liza ile konuştuk zaten. Liza da aynı şekilde İzmir'e geldi. Müthiş bir deneyim yaşamış zaten. Fotoğraflardan ve sunumundan harika bilgiler aldık. Ayrıca son olarak da FM360 değişimleri oluyor. Hipokrat Avrupa içindeydi ama FM360 tüm dünya genelinde olan bir değişim. Burada yaklaşık 4 hafta sürüyor. Süre de uzun, kapsam alanı da daha geniş. Yine aynı konsepte ilerliyor. Peki karar verdiniz, değişime katılmak istiyorsunuz, ne yapmanız gerekiyor? Resmi EYFDM Türkiye mail adresine mail atmanız gerekiyor. Word formatında CV'nizin olması gerekiyor. Word formatında motivasyon mektubunuzun olması gerekiyor. Ayrıca TAUT üyeliğini istiyoruz. Çünkü Wonka'nın ülkemizde kabul gördüğü dernek olarak TAHUT var. O yüzden de TAHUT üyeliğini muhakkak istiyoruz. Bunu mail için eklerseniz çok seviniriz. Exchange başvuru değerlendirmeleri peki nasıl? Bireysel dışında olanlara baktığımızda kongre öncesinde. Onlarda da yani süremiz kısıtlı olduğu için açıkçası bu şekilde görselden ekran görüntüsü alabilirsiniz. Ama aklınıza takılan en ufak bir şeyde direkt bizlere ulaşabilirsiniz. Ve EYFDM Türkiye sayfasından zaten hızlı bir şekilde dönüş sağlıyoruz. Benim anlatacaklarım bu kadar. Beni dinlediğiniz için teşekkür ediyorum. Ben sözümü sevgili Rümeyda'ya bırakıyorum.
Eline sağlık Büşra'cığım.
Teşekkür ederim.
Ee, Ekranım görünüyor mu?
Evet, görünüyor.
Harika. Ben de bilimsel etkinliklerimizden kısaca bahsedeceğim. Önce uluslararası, ondan sonra da ulusal bilimsel etkinliklerimizden bahsedeceğim. Toplamda uluslararası anlamda 3 tane büyük bilimsel etkinliğimiz var. Dünya Kongremiz, konferansımız, Avrupa Konferansımız ve bizim kendi aramızda düzenlediğimiz forumlarımız. Wonka'nın Dünya Konferansı öncesinde biz genç aile hekimlerinin bir araya geldiği pre-konferanslarımız oluyor. Yine Avrupa'da da aynı şekilde. Birkaç gün şeklinde mesela bu senede Paris'te olacağı üzere e, pardon seneye Cape Town'da olacağı üzere e, kongremizin hemen öncesinde 2 günlük bir pre-konferansımız oluyor. Geçen sene Lizbon'daydı. 2025 yılında her 2 senede bir düzenleniyor genellikle. 2027'de Afrika kıtasında Cape Town'da olacak. 2029'da da Asya'da Kyoto'da olacak. Avrupa'daki prekonferanslarımızdan bahsedecek olursak, bunlar da yine her 1-2 senede bir düzenleniyor. Geçen sene Avrupa kıtasında olduğu için Lizbon'da olmuştu. Bu sene Paris'te gerçekleştirilecek. Gelecek sene de Ljubljana'da gerçekleştirilecek. Paris'te biz de olacağız. Sizleri aramızda görmekten mutlu oluruz. Oraya gittiğimizde de bir aile fotoğrafı çekilmek istiyoruz. Dolayısıyla birbirimizi gördükçe selam verirsek çok güzel olur.
Veyda'cığım slide
2028'de
ilerlemiyor şu an için.
öyle
Yine ilk
mi?
slide'da kaldı. Şu an
Pardon, çok özür
ilerledi.
dilerim. Tamam, o zaman böyle devam edeyim. Teşekkürler. Ee, 2028'de de daha önce belirttiğim üzere İstanbul'da olacak. Ee, Dünya Kongresi'nin açılışını hala böyle çok gururla anlattığımız üzere Şeyma'cığım gerçekleştirdi. Bizleri temsilen çok da güzel bir konuşma yapmış. Orada olamadığımız için çok hayıflanıyoruz. Ama giden arkadaşlarımız tecrübelerinden ve bizlere aktardılar ve anlattılar. Çok da gururla bahsettiler. Sadece Türk arkadaşlarımız değil bu arada. Yabancı arkadaşlarımız da aynı şekilde. Türkiye ekibi dediğim gibi orada da yine hatıra fotoğrafı çekilmişler. Bu da Gülşahcığımın Lizbon'daki workshop ve ASM gezisinden anıları. Keşke o şu an anlatabilseydi. Vaktimiz çok dar, o yüzden hızlıca geçmem gerekiyor. Yine İkbal abla bir önceki sene açılış konuşmasını yapmıştı bizleri temsilen. Digital Health ve AI'ın workshop'unun bir görüntüsü. İstanbul için biz 2 sene önce de aday olmuştuk ama seçilememiştik, ama 2028 için seçildik. Bu da Brüksel'den. Yine Gülşah'cığım, Hande'cim orada bizleri temsilen bulundular. Ee, Biz aslında gittiğimizde yani sadece orada konferans alanında kalmıyoruz. Çok kısa bundan da bahsetmek istiyorum. Yani oraları da geziyoruz, bizleri de gezdiriyorlar. Gezecek alanlar için bize yol da gösteriyorlar. Dolayısıyla arkadaşlarımız Avrupa Parlamentosu'nu gezmişler. O da çok güzel bir deneyim olsa gerek. Bir de forumlarımız var. Forumlarımız da her sene gerçekleşiyor. Bu sene Tallinn'deydi. Ben bu kadar güzel geçeceğini açıkçası tahmin etmiyordum. Bayağı soğuktu, çok soğuktu. Yani Kuzey Kutbu'ndaydık gerçekten. Hissettirdi soğuk kendini. Ama gerçek çok verimliydi, çok eğlenceliydi. Yeni arkadaşlar edindik. Çok da kalabalıktı. Açıkçası onlar da bu kadar kalabalık olmasını beklemiyorlardı. Gelecek yıl Malaga'da olacak. Ondan sonra da Leiden ve Rotterdam'da olacak. Çok kısa bizim ulusal etkinlikler. Buradan şeyde bakabilirsiniz. Malaga için kayıt takvimine bakabilirsiniz. Forumlarımız diğer kongrelere göre çok daha uygun fiyatlı oluyor. Biraz daha low season'da olduğu için oteller vesaire de uygun oluyor. Dolayısıyla mutlaka değerlendirmeniz gerektiğini düşünüyorum. Biz de inşallah Malaga'ya geleceğiz. Hatta kalabalık bir ekip gelmeyi düşünüyoruz. Biz ulusal düzeyde de 5 tane ulusal ve uluslararası ülkemizdeki düzenlenen kongrelerde görevlerimiz var. Buradaki etkinliklerde yer alıyoruz. Aile Hekimliği, Ulusal Aile Hekimliği Kongresi TAVUD'un düzenlediği Trakya Aile Hekimliği Kongresi'nde, Uluslararası Doğu Akdeniz Aile Hekimliği Kongresi'nde ve şu an olduğu gibi Doğu Karadeniz Kongresi'nde ve Kıbrıs'ta, genellikle Kıbrıs'ta düzenlenen Güz Okulu'nda. Aynı zamanda ana bilim dallarına ve kliniklere EYFDM'nin tanıtım toplantılarını ve tecrübe paylaşımlarında bulunuyoruz. Ülkemizde düzenlenen EYFDM etkinliklerini yürütüyoruz. Değişim burs ve programların duyurusunu yapıyoruz. Bu sebeple bizi özellikle Instagram'dan takip ederseniz değişimlerden ve bizle alakalı yeni bilgilerden ve bildirimlerden çok daha hızlı ve erken haberiniz olur. O yüzden sizden özellikle istirhamımız bizleri takip etmeniz, özellikle de Instagram'dan ve Gmail adresimizi not almanız. Herhangi bir sorunuz olduğunda da oradan bizimle iletişime geçmeniz. Değişim programlarının düzenlenmesinde ve koordine edilmesinde görev alıyoruz. Kongre ve toplantılarda da aktif rol ve ulusal temsilde bulunuyoruz. Geçen sene açılış konferansını, kongrede açılışı gerçekleştirmişlerdi arkadaşlarımız. Çok da güzel geçmiş, çok güzel geri bildirimler aldık. O kadar güzel yapmışlar ki aynı sorumluluğu bu sene bize tekrardan verdiler. Ve biz tekrar açılışı gerçekleştirdik. EYFDM Türkiye ekibi olarak. Bir şarjımız yanımızda yoktu, bir rahatsızlığı vardı. Eksikliğini çokça hissettik ama bir dahaki sene inşallah tekrar beraberiz. Yine bu sene TAHEK değişim programımız oldu. Yaklaşık Portekiz'den, Polonya'dan, Gürcistan'dan gelen var mıydı emin değilim. E, Ve Yunanistan'dan değişimcilerimiz oldu. Hayli kalabalıktı. 10 kişi değişime gelmişti. Çok memnun kalarak ayrıldıklarını söylediler. E, Bir sonraki kongrelerde görüşmek için sözleştik onlarla da. Doğu Akdeniz Kongresi'ne bu sene ne yazık ki bazı eşleşmelerden dolayı katılamadık. Çakışmalardan dolayı, ama seneye tekrardan orada da olacağız inşallah. Ve Doğu Karadeniz Kongresi maalesef yüz yüze gelemedik bu sene. Online olarak devam ettik ama seneye burada da yüz yüze görüşmeyi çok arzu ediyoruz. Ana bilim dallarına dediğimiz gibi sunumlarda bulunduk. Manisa Celal Bayar'da, Cemil Taşçıoğlu Şehir Hastanesi'nde ve Hacettepe Üniversitesi'nde tanıtım toplantılarında ve birçok başka ana bilim dalında da tanıtım toplantılarında kendi ana bilim dallarımızda bulunduk. Burada sözü çok hızlıca Gülşah'a devrediyorum.
Herkese merhabalar. Şimdi bir sonraki oturuma birkaç dakika kaldı. O yüzden sunumu yapacak maalesef vakit kalmadı. Gönül isterdi ki uzun uzun ödüller ve bursları anlatabileyim. Bir dakikada hızlıca toparlayayım ben. EYFDM Türkiye'de Ödüller ve Burslar Koordinatörüyüm. İsmim Gülşah. Şimdi bizlerin değişimlerde ve kongrelerde önümüzdeki iki önemli bariyer, biri dil bariyeri, diğeri ise maliyetler. Hem VONCA hem EYFDM aslında pek çok ödül ve burs fırsatları sunuyor. İşte kongre öncesinde duyurular yapılıyor. Aynı zamanda sizlerin bilimsel çalışmalarını ve akademik hayatını destekleyen de çeşitli ödül ve burs programları mevcut. Bizler bunları web sitemizde, TAUT web sitesinde, EYFDM ana web sitesinde ve Instagram, Facebook hesaplarımızda güncel olarak paylaşıyoruz. O nedenle bunları takip edebilirsiniz. Ben sözü moderatörümüz Şeyma Handan'a bırakıyorum. Çok teşekkürler.
Gülşah, anlayışın için çok teşekkürler. Çok güzel toparladın. Sorular illaki muhakkak vardır. Arkadaşların soruları. Bu durumda muhakkak bizim EYFDM Türkiye Instagram hesabını takipte kalın. Oraya ulaşabilirsiniz. Onun dışında Gmail hesabımızı paylaştılar arkadaşlar. Ondan ulaşabilirsiniz. Rüveyda telefonunu paylaştı. Orada ulaşabilirsiniz. Çok teşekkür ediyorum. Biz arayı da kullanmış olduk ama 9 çok güzel, kıymetli konuşmacımızla birlikte çok umarım dolu dolu sizler için de dolu dolu bir toplantı ve session olmuştur. Çok hızlıca İngilizce kapatayım yabancı arkadaşlarımız için. We have come to the end of our session and what a rich 90 minutes or 2-hour session it has been. From professional identity and advocacy to knowledge circulation and the transformative power of international exchange. On behalf of EYFDM Turkey, I would like to once again thank the organizers of the Congress and all of the professors and members of the CASET and all the university teams for hosting this session and for their continued support of young family doctors. Many special thanks to our distinguished speakers and to everyone in the room and online. If today inspired you, please reach out to the EYFDM Turkey team, follow EYFDM.eu and EYFDM and EYFDM Turkey Instagram accounts, and consider applying for an exchange or joining any upcoming events. The moment grows with each of you. Thank you all and enjoy the rest of the Congress.
Thank you. Have a good time in there.
That's it. Thank you. Thank you, Lisa.
Thank you.
Thank you.